pancreas transplantation in diabetes. I know this may not be a topic of much interest to many and also not discussed regularly. Being a consultant diabetologist, one of the most common questions encountered in my outpatient from my diabetic patients is whether diabetes is a completely curable illness or not. One must realize that if type 2 diabetes mellitus is detected in the pre diabetic stage, with proper lifestyle modifications, diet, and exercise, it can be reversed. But once you have crossed the pre diabetic stage and have become a diabetic patient, it cannot be cured completely. Then the often asked question is about pancreas transplantation and how effective it is in controlling or reversing diabetes. I shall very briefly explain to you about this today. We must realize that pancreas transplantation is a type of surgery in which you receive a healthy donor pancreas. It is usually done in type 1 diabetic patients. In type 1 diabetic patient, there is usually autoimmune destruction of the beta cells of pancreas, and thereby pancreas stops producing the hormone insulin, and hence the patient will require lifelong insulin therapy. During pancreas transplant, the patient receives a healthy pancreas from a donor who has died recently. We must realize it is not a routine treatment because it has its own risks and also is very expensive. It is usually done only in type 1 diabetic patients and is usually not considered if the patient also has severe kidney disease, nerve damage, eye problems, or any other complications of diabetes. A pancreas transplant works best on people without heart or blood vessel disease. If the patient also has advanced kidney disease, usually a kidney transplant should also be planned along with pancreas transplantation. It can be done either earlier or even after pancreas transplant. The first human pancreas transplant was completed in 1966. Even though it is not done commonly in type 2 diabetic patients, it is being carried out occasionally in type 2 diabetic patients who require continuous insulin therapy. It is not a treatment option for type 2 diabetic patients because type 2 diabetes mellitus occurs when the body becomes resistant to insulin or unable to use it properly, rather than due to a problem with insulin production in the pancreas. But some type 2 patients have both insulin resistance and low insulin production. In such patients, pancreas transplant may be a treatment option. The aim of a transplant is to restore normal glucose levels to the body. The transplanted pancreas is found to be able to produce insulin to control blood glucose levels. One must understand that pancreatic transplant is not a procedure which can be planned in a few days. The evaluation process to see if you are an ideal candidate for the procedure itself will take a couple of months. A thorough clinical and investigational evaluation, including various blood tests, blood typing, screening for communicable illnesses such as HIV, HPSAG, hepatitis C virus, renal function evaluation, neuropsychological examinations, chest radiograph, electrocardiogram, echocardiogram, etc. should also be done. Evaluation should also be done to see if you will be able to handle the post-transplant drug regime. If you are found to be an eligible candidate, you will need to be enrolled in the recipient list and await for an appropriate donor. A pancreas donor is usually someone who's declared brain dead but remains on a life support machine. The donor's pancreas also has to match immunologically with the recipient's body. This is important to help reduce the risk of rejection of transplant. Rejection usually occurs when a recipient's immune system reacts adversely to donated organ. Very rarely a living donor who is a close relative or identical twin of the recipient also can donate a part of their pancreas but not the whole organ. Rejection is the most serious risk associated with pancreas transplant. Transplant recipients will have to be on long-term or lifelong medications including immunosuppressants, etc. to prevent rejection. Pre-transplant evaluation of the recipient will have to be hence weighed on the long-term benefits and risks of transplant against the complications and potential for death associated with diabetes. The common types of pancreas transplants done are either a solitary pancreas transplant or a combined kidney pancreas transplant or a pancreas after kidney transplant or a pancreatic islet cell transplant. The choice of the type of transplant is decided based on the patient's age, clinical condition, complications in the patient, and also availability of the appropriate donor organ, etc. Now, let me very briefly explain about the surgical procedure. It is a procedure which usually lasts about 3 to 6 hours, depending on whether the patient is having pancreas transplant alone or kidney and pancreas transplant at the same time. In this procedure, through the incision made in the abdomen, the surgeon places the new pancreas and a small portion of the donor's small intestine into the patient's lower abdomen. The donor intestine is attached to either the patient's small intestine or bladder, and the donor pancreas is connected to blood vessels that also supply blood to the patient's legs. Patient's pancreas is left in place to aid digestion. More than 95% of patients survive the first year after a pancreas transplant. Organ rejection occurs in about 1% of patients. If transplantation is successful, the recipients may have a stabilized blood sugar level without the need for external insulin injections. They also have a better quality of life.